thank you for coming to this month's session of Nursing Grand Rounds. On behalf of the Professional Development Council, we are the ones putting on the Nursing Grand Rounds, and thank you for coming, and please remember to fill out your online evaluation. It is open on Insight for 2 weeks after today's session, and we also have the laptop set up in the lobby as you exit. Today we have Teach Back method for patient education. We have Lauren Aid and Laura Bullock.
Hi everybody. We're going to talk a little bit about Teach Back. Probably not anything too crazy new for you guys. But I'm Laura Bullock. I'm the transitional care pharmacist here at the hospital. At the end of this presentation, what we want you guys to be able to do is to identify what the Teach Back method is and how to use it effectively, and really also understand its importance in patient and family education, and also identify how to improve your patient and family education and assess comprehension using this Teach Back method. So communication is something we all do every day, right? We're communicating with each other, we're communicating with other disciplines, we communicate with patients. That's a big part of what most of us do. And one of the big pieces of that communication with patients is patient education. And we know, I think most of us can say that we see breakdowns in communication almost every day. And so one of the biggest breakdowns we see is patients being able to understand what we're trying to educate them on and what we're trying to communicate to them. And so I'm going to show a video that kind of gives an example of when things go wrong, basically.
Well, sometimes doctors make mistakes. Anna, you have to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
Jerk.
So that seems kind of really over the top, and that wouldn't happen in real life, but I actually have had that happen to me in real life. I was riding in the elevator. I wasn't even doing patient education, and a patient was also in the elevator with me, and he pulls out his inhaler and he's just like spraying it, and I couldn't help myself. I had to ask him, did you feel that? Do you feel better now? And he's like, oh yes. So I couldn't help myself. I had to go ahead and have a conversation with him, but I just thought, did that really happen? But I'm sure we've all had moments when we're educating patients and we're talking to them and they're just nodding along and saying, yeah. And at some point you have this thought in your head that, man, I don't think this person really knows what I'm trying to tell them at all. And then on the flip side, I know I've been a patient, and a lot of us have been in that situation where we go, and even though we're healthcare providers and we go and we're like, yeah, we know what we're supposed to do, and then we get home and it's like, wait a minute, what did they tell us? What's supposed to happen? So it's just kind of that disconnect, and Teach Back is something we want to help teach you guys or talk to you guys about so that we can work on that and keep that from happening. So what is Teach Back? What is it that we want to try to do? So it's a communication tool that's aimed to improve health literacy and health communication. It's also called the Show Me method, it's related to the Show Me method. And basically what we're trying to do is ask the learner to explain back the information that's been taught. And so this gives the teacher or the healthcare provider the opportunity to evaluate the comprehension of that education and then be able to re-explain things if it's necessary. It also allows the learner to be able to teach it back in their own words. And so we really know whether or not they were able to comprehend anything, because if they just repeat our words back to us, we can't really assess whether or not they truly know what that meant. And it really does close that gap between education and understanding, because if we're trying to educate patients and they don't understand, we didn't really do what we were supposed to do. So 2 important things to remember that Teach Back is not. It's not a quiz or a test. It's not to put your patient on the spot or the learner on the spot. And it's not meant to be intimidating. It's really meant to be just a way to make sure that we're doing the best job possible teaching that patient. So why is it important? Research does suggest that patients remember and understand less than half of what clinicians and providers explain to them. And that is really scary when we think about it, because then when patients don't know what to do or can't remember what to do, their disease state isn't controlled, they have poor outcomes, there can be adverse drug events, use of the ER, and readmissions. So we want to make sure that we try to avoid those things. And then specific pieces of the puzzle that to us may seem easy to understand, or we wouldn't think that people would have trouble understanding that. So the American Medical Association has some numbers, and they say 42%, so that's a lot of people, almost half, of patients are unable to comprehend their directions for taking their medication on an empty stomach. To us, that doesn't sound too hard, but that's a lot of people who aren't able to comprehend that. And then 26% were not able to understand the information on their appointment card. So just the card that says the date and time of their appointment, they weren't able to really understand what that was telling them. And then something we work with in the hospital a lot, probably every day, are consent forms. And the American Medical Association says that 60% of people did not understand the standard consent form. And so when we think about what we're doing every day, that's a large population. So this can be really frustrating for patients, it can be frustrating for us, frustrating for the family, it can be really dangerous because like I said, then bad things happen, adverse events happen, they might have to come back to the hospital, they might have to come to the ER, we might have to do something to reverse whatever it is that has happened because they didn't understand the right thing to do. And so why is it important for us to use this? Why are we even talking about this? And so really we want to remember that health literacy is a right. Everyone deserves the right to understand their healthcare education. And we as healthcare providers, it's our duty to explain that information to them, their health information, in understandable language. You know, we have vernacular and words that we use every day that are just normal to us, but those words may not be normal to patients. And one of the examples, I actually picked up on that, the provider continues to talk about abdominal, and then in the video the patient says abdominal, but how many of our patients really say that to us and really understand what we're trying to say when we say that word? But that's something we use all the time. So the other important thing to remember is that this does not require patients to be able to read or write, because this isn't dependent on a piece of paper, it isn't dependent on them writing something down. It's the conversation that you're having with the patient to be able to say, okay, you're giving information to them, and then you're getting from them what they were able to comprehend. So we have patients that can't read or write, and this may be a good tool to use for them. And so we always also want to practice evidence-based medicine and use evidence-based practice, and TeachBack is part of that. It is a research-based health literacy intervention. We know it promotes adherence, we know it increases quality of our care, and we know it promotes patient safety. So what we're really trying to do, again, is just close the gap between our patient education and patient understanding. And so being able to explain that concept, gather from the patient, have the patient explain it to us in their own words, being able to assess what they understood, and if they didn't understand something, then we can re-educate on that and then reassess what they did gain. And now I'm going to turn it over to Lauren.
So now I'm going to talk to you about how to use the TeachBack method. There's basic principles within the TeachBack method. Of course, like Laura said, to always use plain language. The things that we say every day to communicate with each other, within our teams, within our disciplines, usually sounds like a foreign language to the patient. So the other important part is to know your audience and to know what their education level is and what kind of slang or terms they use that you can also incorporate into your teaching to have them better understand it. Speaking slowly and clearly, breaking down the information into short, digestible statements. If you're teaching more than one concept, it's important to focus on the 2 or 3 most important parts of that concept, use the TeachBack method in order to assess understanding, and then go on to the next main concept. And always, you'll see a theme, to have the patient or the learner explain it back using their own words. like I said, a theme. Always ask them to use their own words. Anyone can just repeat whatever you say, but it's important in the teach back method for you to know that they truly understand it. And using a caring voice is always helpful to not sound like you're judging or testing or being intimidating. And checking for understanding by saying something like, I want to make sure that I've done a good job by explaining this to you. Can you tell me in your own words how your diet affects your blood sugar? So it places the responsibility on the provider rather than the patient. Another important thing is you're on a couple of different new medicines. Can you explain to me what they are and how you're going to take them? Again, making sure your patients know that your goal is not to test them, but to make sure that you've done a good job of explaining their health information. Avoiding closed-ended questions that result in a yes or no answer, such as, do you understand, or got it, and asking open-ended questions that start with what or how. And when appropriate, it's always helpful to have your patient show you how to do something like checking their blood sugar, their blood pressure, giving themselves insulin, or using an inhaler to prevent them from using it like perfume. And when to use it, ideally you'd use it on every patient every time. But these are some highlights, especially for treatment options, procedures, education about new diagnoses, medication education, adherence to a treatment plan, and it's really important in discharge and follow-up instructions. Without teach back, patients might go home without the proper health information that they need, and that can lead to adverse drug events, non-compliance, not because they didn't want to take their medicine, but because they didn't know how. Inappropriate utilization of resources like the ER, and readmissions to the hospital. Some of these events can be really detrimental to the patient. As the transitional care team, we see this a lot where a patient will come right back from the hospital and we'll kind of go in and see what happened. And they were taking their blood pressure medicine, but they were taking too much. And their blood pressure when they got to the ER was 60 over pill. That happened pretty recently. So to avoid detrimental, even sometimes fatal events, using the teach back method might help. And Fred Marsh said this, in the absence of teach back, the only indicator of misunderstanding may be a medication mistake or a patient error, which could be harmful. For documentation, this is my daughter. She's happy that we have documentation now. This is rather new, but it's in the nursing education form, and you just pick teach back. You don't have to type it in anymore. And then we have 2 videos to show you.
So Mrs. Brown, you'll be going home with ibuprofen for your leg pain. Have you heard of this before?
Kind of.
Okay, the other name for it is Advil and Motrin. How about that?
Sounds familiar.
Okay, this is to treat inflammation, fever, and in your case, pain. Some potential side effects are stomach pain, diarrhea, constipation, and ringing in the ears. Some urgent side effects are chest pain, shortness of breath, weakness, or bleeding or coughing up blood. Now, this is a medication card that I'll be giving you to take home. It'll have all this information on there. But for now, can you discuss what I've given you so far, as if I was a family member and you were teaching me?
Yes.
Okay.
So I'm going to be going home with medication ibuprofen, and this is going to be for my leg pain. And some side effects that I might feel is maybe upset stomach or vomiting. And if and when I feel chest pain or short of breath, that I should go to emergency room.
Right. So you're going to be taking, as you can see here, it says the dose 600 milligrams. For pain as you need it. So if you're not in pain, don't take this medication.
Okay.
But do not exceed more than 4 doses a day. And that's also written on your bottle, so you'll never forget, okay?
Okay.
And then special instructions with this medication are to take it with a full glass of water and meals.
Okay.
No, do not take it on an empty stomach to prevent the stomach pain, okay?
Okay.
This little med card is going to go in your care folder, so you'll always have it with you.
Okay.
So can you discuss the last portion of what I just said to you? Can you teach it back to me?
Yes. So I'm going to be taking 600 milligrams, and I just have to make sure that if when I take this that I have something in my stomach or I have food and water, and to make sure that I only take it when I need it, and I shouldn't have more than 4 doses a day. And it's all written here, and the rest of the stuff that you told me.
Okay, great. And Any other questions?
No, thank you very much. It's
Okay,
clear.
you're welcome. I'll put this in your care folder, okay?
Okay.
All right.
I'm going to show this one next. It's an example of an inhaler.
So this is a meter dose inhaler, and what it does is it distributes a specific amount of medication into your lungs. So while I'm opening it, do you mind explaining to me what it is?
The inhaler helps release medication into my lungs.
Good, exactly. So this is how you're going to use it. You're going to take the cap off, and you're going to inspect the mouthpiece to make sure that it's clean. You're going to shake the inhaler 10 to 15 times, and then you're going to connect it to your spacer. When you're putting it into your mouth, you want to make sure that you put all your lips around it, and you also want to make sure that your tongue is below or under it, okay? And you want to make sure that you close it around your mouth. So when you're going to spray, you're going to tilt your head back slightly towards the ceiling. You're going to take a deep breath in, and then you're going to spray. You're going to hold it for 5 to 10 seconds in your mouth, and then you're going to breathe out slowly, okay? And I just want you to remember that this is a steroid, so basically what it means is that after you have already sprayed it, it's really important that you wash out your mouth after. So you just want to rinse it with water, okay?
Okay.
So do you think you can explain to me how to do it?
Yeah, I think I can.
Okay. So would you do first?
So I'm going to inspect to make sure that it's clean and that there's no weird, like, fungus or whatever around it.
Mm-hmm.
And then I'm going to shake it 10 to 15 times.
Mm-hmm.
And then I'm going to attach the spacer.
Good.
I'm going to tilt my head up to the ceiling and then wrap my mouth around it with my tongue underneath and have a firm grip around it with my lips.
Good.
Then I'm going to take a deep breath in and then spray and then hold that breath for 5 to 10 seconds.
Good, good.
And then I'm going to slowly breathe out through my nose for about 5 seconds.
Okay, yes.
And then I got to make sure after I'm done using it, because it's a special type of medicine, that I have to rinse my mouth out.
Exactly.
Okay.
Great. Do you have any other questions?
No, I think I got it.
Okay, we'll be practicing throughout, and you can try it later on too,
Okay.
if you want to, okay?
Okay.
All right, so as you can see, TeachBack doesn't take but a few extra minutes in order to assure that your patient truly understands their discharge instructions or instructions about a new medicine or new disease state. So what we'd like to do is open it up and see if you all have any questions about any barriers that you might encounter using the TeachBack or any other questions that you might have. Yeah. Yeah, that's a good question. So the question was, how can you allot time when you have 6 and 8 patients apiece and your team leader also does and you don't have a discharge nurse? So one of the biggest goals that we have as a team and really as an organization is to do this teaching not on the day of discharge. So to do it throughout their stay and really to start their discharge teaching at admission and start talking about, when they have a new diagnosis or a new medication, to do the teaching then using TeachBack, and then at the time of discharge, the patient will already have that information. You can just have them recall it. So I think when you're biting off a little bit at a time, it's easier for a nurse, especially I was a nurse on the floor for a long time, I know. When you're biting off a little bit at a time, it's a lot easier than trying to do all of their discharge teaching at the end. So that's the best answer that I can give as to how to approach something like that. I don't know if you have anything to add.
I'll just add, as a pharmacist, I think about medications a lot. So in my mind, you're giving patients medications all throughout their stay. Some of them may be home meds, some of them may be things that are treating what's actually going on with them. And I know you guys have the first dose education that you have to do and document that. And so, if you're giving a patient a medication, just kind of taking a minute to just, when you're doing that and explaining what you're giving to them, kind of having them say, okay, this is my Bumex that you're giving me, or my water pill, or you're giving me my water pill and my IV so that I can get rid of some of my fluid. Just, kind of, it's, a 2-second conversation, but it's showing that you're teaching them, and then that they're also absorbing what's happening to them and why they need to get water off or whatever is going on.
I think the best answer that I could, or recommendation that I could give, is to maybe request that the family member, when they come in to pick that patient up, that they come in a little bit early. And I know I've already talked about not doing everything at discharge, but sometimes it's hard to avoid. Yeah, so I know those situations happen, and it's frustrating for the nursing staff, and it can be frustrating for the family and for the patient, because they feel like everything's very rushed when their family member gets there. I remember multiple occasions when the family member got there and they just wanted to leave right away, and I was like, no, I need to tell you about this stuff because it's really important. Anything?
One of the questions she asked was about over the phone, or if the patient is not in, or the family member isn't here with the patient. And I think that Teach Back can be very useful in that setting. The show me piece is the part that's going to be the hardest, because if there's something, say drawing up insulin or dressing changes or something like that, of course you can't show that over the phone. But as far as Teach Back, like follow-up instructions or medication information or things that are information-based, that can be done over the phone, because again, it's them repeating or being able to tell you in their own words what their plan is, what they're going to do when that patient gets home, and what they understand that they're supposed to do or pay attention to, or when they're going to when and what doctor they're going to see, and that kind of thing. So I think that piece over the phone is not as difficult, but the show me piece definitely is not going to be possible.
Just as an aside, sometimes we already use this Teach Back, a light version, I'll say, of Teach Back when we're doing a consent form over the phone. So you have to explain the consent, the procedure, the risks, the benefits, or the physician is supposed to do that. The physician does that. And then you have 2 nurses verify that the family member understands the procedure and consents. So you're kind of already do it in a light way. All right. Well, we thank you.